Hello, everybody. Thank you so much for coming. I am really excited to talk about this topic with you. I am excited to share with you this framework that you can use to ditch panic, to ditch feeling frantic, to ditch Googling when your child is sick or hurt. So let's dive right in. I'm going to teach you the framework that you need to know to really be able to use natural remedies successfully and effectively in your home. All right, this training is for you if you feel convicted to use natural remedies for your family, but you are just not sure, like quite sure how to do it. You're like, I think I tried. I've dabbled in some things, but I am just not really sure how to really make it work. This is for you if you are not sure when to use natural remedies and when to get medical help. So if you've ever been in that place where you're like, okay, this thing came up, I think maybe I can deal with this at home, but I don't actually know. Like, is this something that I should be seeking help for? I'm not really sure, right? So if you've ever been in that situation, say yes. Give me a yes in the chat. Nod your head if you felt like unsure if you should be in the hospital or if you should be at home. This is also for you if your convictions go against the norms of your family, your friends, your doctor's office. So if you feel like you're just kind of in an island, if you are not really going along with the people around you and you feel isolated, then this is absolutely for you. I know it was definitely me for a little while. This is for you if you have bought lots of remedies and tinctures and you just don't know how to use them. So if you have a closet full of things that you're like, oh, that tincture looked really good. This often happens from social media, right? Where you're like, oh, there's that list, or I saw this thing, it seemed really good. And now you have it in the closet and you're just not sure what to do with it. Then perfect. This is a good spot for you. And then also just if you feel really overwhelmed with all the info out there. So I definitely acknowledge I'm not the only one talking about natural health. There are so many voices out there, people that are giving you their lists and, oh, when something happened, when the fever pops up, that's a big one, right? Fever pops up, it means this, you have to do this, but then there's conflicting information, and it can get really confusing. It can get really overwhelming. So if you do feel overwhelmed, my hope with this training is to help narrow that down and make it actually very simple. That's how I work. I do not want to have a ton of different things that you need to be thinking about and trying to sort through, but like, let's get to the common denominator. Let's get to the very simple aspect of what's true with our bodies. All right, so this is for you if you are any or all of these things here. Now, this training is not for some things or for some people, so I want to acknowledge if you are here looking for emergency medical advice, this is not the place for you. Call an ambulance, go to the hospital. If you are here like, oh, my kid's in a crisis right now, that's not what we're doing right now. You are always welcome to watch the replay afterwards. Go get help if you need that. This is not for you if you are looking for a quick fix more than long-term healing. So if you are you're more in the place of, okay, well, my kid gets sick, I don't really want to take time to do that long term. I get maybe that's important, but right now I'm just really looking for like the quick, like, what can I do right now to just make them feel better? We're not really addressing that right now. Yes, we are addressing acute things, meaning things that arise, a fever that just happened, a bellyache that just happened, a head injury that just happened. But we're going to talk about it from the understanding of long-term healing and helping your kid get more resilient and stronger. This is not for you if you are just looking for a list of remedies. I love remedies. I think they're so fun, but that's not what we're doing today. I'm not going to be like, this is what you do when this happens. This is what you do, because there's lots of lists available. And that what we're doing more today is how do you go about it? What's the framework that you need to actually take those lists and make them really work for you? Right. So we're going to be working on root cause of your child's symptoms rather than just talking through lists of remedies today. And then this is also not for you if you're content with defaulting to medications when symptoms pop up. So if that is you, that's fine. This is just not going to be your cup of tea because that's not the goal here. I think medications are appropriate in certain emergent situations, and that's it. That's where it stops. So when we are addressing healthcare at home, there are many other things that we can do, and that's what we're going to really be addressing today. All right, so the framework that I'm going to teach you, the parent-led health framework or method, is what I created because of a question that I kept hearing. And one of the moms who asked me this was a patient of mine named Jessie. She was in my office and she said to me, I'm so scared that I am going to be giving essential oils to my son when I should have him in the ER. And I remember this very, very well. This was about 4 years ago, maybe 5 years ago at this point. And I can picture exactly where she was because it was such an interesting concept for me that I thought, okay, why am I not in that place? I'm not concerned about that. Why is that? I realize I actually have a system and a structure and a framework that I created for myself to be able to not be in question about this, to be able to make really good decisions about, do I go to the hospital? Do I care for it myself? And so I thought through the structure that I had in my brain and created it to bring to other moms who were in the similar position as this. And so once I did that, shared it with her, this was her response to that. She said, I'm not scared anymore. After she practiced for a little bit of time, I'm not scared anymore. I know how to tell when something is urgent and I know how to keep things from becoming urgent. So not only was she not scared anymore, but she knew how to identify, is this a hospital situation or not? And then if it wasn't, and she could care for it at home, how to keep it from escalating, which is a really important part. And that's part of what I'm going to teach you today. So today we are going to learn 3 secrets. Number 1, how to get away from your initial response of panicking, Googling, and defaulting to meds. So if this is you, give me like a hand raise or a yes. If you have been in this position where your initial response when sickness pops up is panicking, Googling, you're like, oh no, I don't know what to do. I don't want to do this, but here's the Tylenol or whatever that med might be, right? If that has been you, I've totally been there. I get that. We're going to talk about that first. Next, we're going to talk about that you can be trusted. Secret number 2 is you can be trusted with your child's symptoms. You do not need more credentials. You do not need to go back to school. You just need the repeatable system that I'm going to be showing you here today. And then secret number 3 is how to start healing your child naturally, even if your spouse is not on board or if you don't have a full kit of remedies. So if you are like, okay, that sounds good. Yeah, I want to do this, but my partner, my spouse is not there and there's always this pushback, you can still start healing your child naturally, and we're going to talk about that. Or if you don't have a ton of remedies and you don't you don't really know how to get started because you only have maybe a couple things, or you feel like you don't have any remedies, you can still get started, and I will help you figure out how to do that. All right, so at the end of today, for everybody who's at the end, I'm going to give you a link that's going to be kind of a cheat sheet of what we're talking about here today. So I'll put that in chat at the end where you can grab that free PDF, just so that you don't have to be like getting a cramp taking notes, but do have something to take notes just in case there's something that really struck you today. Have that nearby, but I'll go ahead and give this to everybody who's here at the end. All right. So, when I was in high school, I would write papers, and my mom would be like, you have to take out all this fluff. She would call it fluff. And it was anything that was not necessary, or just filler words. She's like, no more fluff, only things that are important, only words that are really important, that are going to paint a picture and they're going to be really helpful for the reader. So, here is my no fluff, no impossible promise for you today. We are going to address factual, logical, time-tested, practical ways to implement natural health effectively. Okay, we're going to be very to the point. We're going to keep this right about an hour, and then we're going to have any questions afterwards. If you have questions in the middle, you're welcome to put them in chat, and I will address those after. But we're going to really be addressing the practical ways for you to implement natural health effectively. And then after this, I'm not going to say like, oh, and this is all you need, and then after this, your family is going to be fully well. After this, it's up to you to continue learning and practicing and making this really work for your family. But this training is here to get you really well set up so that is your next step, your right next step, and you know exactly what to do from there to make natural health work for your family. All right. So who am I? My name is Holly. I am a registered nurse. I worked for over 12 years in the emergency department, in critical care departments all around the United States, and even in some different countries, actually. I then became a functional nutritional therapy practitioner. So I am no longer working in hospitals in that medical setting. Now I fully work in a holistic and naturopathic sense. I'm trained in the functional assessment and using food to heal the root cause. What that means, that functional assessment is assessing the body, understanding symptoms, understanding what it means when your hair is a certain way, when your belly feels a certain way, when your tongue looks like a certain thing, when your eyes look a certain way, what symptoms mean as they pop up. How do we understand that in a holistic sense? And then how do we heal that, or how do we respond appropriately to heal what the body needs healing from? I'm a certified GAPS practitioner, so I specialize in using food to heal and seal a leaky gut. I do lots of speaking and educating. I love being on podcasts and speaking in conferences and teaching and collaborating. And I have several courses that I've created really to help parents, all fully aimed at helping parents really own their family's health, having confidence, being able to peacefully, wisely know how to manage their family's health. I also do one-on-one care. So I have a private clinic and I collaborate with different practitioners who refer over to me. I do a lot of holistic primary care. So for people who don't want to go to a typical primary care setting who are local to me, a lot of times will utilize me to assist them with types of primary care. I'm also a mom of three. So these three kiddos are really what inspired me to become a holistic practitioner and to really go on this whole route. And I am fully obsessed with going all in with health. So I'm really not an 80-20 kind of person. Like that is just not my personality. I'm like, hey, if something's good for you, just go all the way. Like, let's just thrive. Let's not be pretty good, you know? So I am really obsessed with going all in. And I hope I inspire you to do that as well, because it's amazing. All right, so here's my timeline. So up till 2016, I was very medically dependent. I wasn't actually on medications, but I fully believed in the medical system. Like, oh, something is wrong, you go to the doctor, they give you a prescription, you do it because it's safe and effective, right? And that was fully me. I was working in the hospital. I had been in the medical field for a while. In 2017, I had my first child. And that is when I immediately started having convictions. And I was like, oh, actually, I have questions. Why are we supposed to be injecting her with that? Why are you telling me that my postpartum symptoms might be a brain tumor when maybe it's something else? Why are there was a lot of questions I started having. I was not just taking the medical field at face value like I had before. And I really, really believe that this is what most parents do when you have a child, that you suddenly start thinking differently, that you suddenly start asking questions and having these convictions. So when this was happening to me, I started asking those around me, like, hey, what do you think about this? Like, I feel really weird about this, or this doesn't sound right to me. And for a while, everyone around me that I was talking to was like, no, that's not a thing. It's just postpartum, it's hormones. It's, of course you're stressed, you're not sleeping, like you're going to have different questions and things, but just go along with it. Like, they are here, the doctors are here to really help you. They are here for your best interest. They're safe, right? But it just did not sit well with me. I kept seeking confirmation that I was not crazy, and that I wasn't just going off of hormones, and that I was actually logical in my thought. And I finally found those people who were like, yes, pursue that. You are right. And that really is what jump started my whole exploration and career in life in holistic health. So after that, I went back to school for functional health, got different credentialing and different kinds of holistic practices and ways to support families. My family from that time has never been back to the hospital. never been back in medical care, standard medical care, never used a single pharmaceutical since that time. And my daughter had been in the NICU. She was very critically ill. We didn't even know if she was going to live. I was having major, major issues and was recommended to go through lots of experimental drugs and trials and things. And that's when it stopped for us. And we are truly thriving. And so from there, now I've started bringing this to the people around me, or I have been for, for a while now. So that's my timeline. This is why I share that with you. Because I think for most people, this is where they stop in that conviction seeking confirmation time. And when you stop there and when you don't keep pursuing and you just are told by people like, no, I mean, yeah, that's a funny question, but you know what? They debunked that myth. No, things don't, injections don't cause problems. Nope, don't keep pursuing that. When you stop there, all the rest of this, your family proficiency and your ability to really understand your body and your ability to be hands-on with your family, it just does not happen. And you really get more and more and more dependent in the medical field. So I know that this is where many people have found me when they're like secretly trying to find confirmation. They're like, well, I'm just going to stop asking the people around me. And then they find me. And so if that's you, I am so glad you're here. Do not stop seeking confirmation. And here's your confirmation. You are right to ask, to pursue better for your family. So the way that I went from medical dependency to really being able to be proficient in healing my family was like this, right? So I was an ER nurse first, and then I became a mom, and then I started seeking, and then I went through all the classes and things to become a health provider. But you do not need to do this. So what I really want you to know is if you are a mom, you're a caregiver, and you're having convictions and you're having a desire to help your family, whether you have little kids, whether you have big kids, whether you're working with grandkids, no matter what it is, you don't have to go back to school. You really just need a system that I'm going to teach you today, and you will be able to have proficiency, feel confident, feel calm, feel wise, have what you need to really be able to own your family's health. All right, so let's dive into secret number one, how to get away from your initial response of panicking, Googling, defaulting to medications. Again, if this is you, if you're watching later, or if you're here right now, give me a yep, give me a yep. All right, so so the first 10 minutes matter more than you think, okay? This is really important because a lot of times it's easy to just be like, oh, something's happening. I'm just going to wait it out. I'm just going to like see what happens. I'm not going to get too intense with this, but the first 10 minutes really do matter more than you think. Sickness thrives on impulse decisions. Okay. So when we don't have a structure and we don't know, like, oh, something happened, I'm going to do this, then this, then this, sickness really does thrive on impulse decisions. There's an old saying in the medical system that intervention begets intervention. When we make impulse decisions, when we don't have a system and we just think through like, oh, like a knee-jerk reaction, right? You're just like, I think I'm going to do this right now. I'm going to do this. That's where you start doing interventions that beget more interventions. Meaning when you interfere with what the body is doing and you just kind of make an impulse decision and you interfere, you're going to have to keep on interfering. You're not going to see resolution, and you're going to just keep on having to do more and more interventions for your child. The truth is, children heal when moms are wise, calm, and prepared. Okay. So when we approach a situation not on impulse decisions, not on, oh, I don't know what to do, but I'm just going to like throw this medication in there, do this thing to try to stop whatever's going on. That when we do that, sickness thrives. When we approach calmly, wisely, and prepared, then our kids start to heal. So what do we do first in those first 10 minutes and really in the first couple seconds? What are we going to do first when our kids are sick or hurt? Well, we only have one job. So in that moment, you notice your kid has a fever. You notice your kid has a bellyache. You have one thing to do, okay? It is not Googling. It's not panicking. It's not running to your cabinet and finding your remedies. It's not giving the medications. Your first job, your one job to do is to determine, do you go to the hospital? Do you stay home? That's it. Okay, that is your one initial job to do. Do you go to the hospital, meaning is this an emergency, or you stay home, meaning it's not an emergency? Okay, that's the only differentiation we're going to make right now. So how do we know? You're like, okay, yeah, sounds great. How do I know that? All right. So here's how we do it. You're going to take in the scene. So first, whatever's going on, you're going to just take a look overall at the obvious. Like, was somebody hit by a car? Take them to get checked out. Was somebody run over, trampled by a horse? I live in the country, so that's possible. Go get them checked out in the hospital, right? Is somebody not breathing? Is somebody completely unresponsive? Like that's a very obvious, that's an emergency situation. So you're first going to just take in the scene. Is somebody bleeding excessively or have a bone sticking out? If you're taking in the scene, you're like, there is an obvious crisis right now. You take them to the hospital, right? If there's not an obvious crisis, now we're going to step down and we're going to assess the child. So in doing this, now we're going to move on to these two questions. Number one, is there a critical symptom? And number two, do I have the knowledge, the skills, and the tools to take care of this? So first, is there a critical symptom? Critical symptoms are things that you simply don't have the knowledge and the skills and the tools to take care of. So if you're like, okay, they are struggling to breathe. Now, is this a critical symptom? Well, it has to do with, can you manage this? Do you know what's going on? Do you have the skills to take care of this? And do you have the tools to take care of this? Critical symptoms looked really different when I first started working in natural health versus now. So about 10 years ago when I started, there were a lot more critical symptoms that I just didn't have the skills, the tools, and knowledge to take care of. And so more things were critical. Right now, very, very, very few things are critical for me. So when you approach a situation, what you're going to look at is this a critical symptom? Some common critical symptoms are things like, this isn't just like like, oh, they got a bug bite and they're crying and it hurts, right? But like, are they blue? Are they not responding to you? Are they is there uncontrolled bleeding? Is there pain that's really disproportionate to the situation? Um, is there a fever and they have a really stiff neck and they can't move and they're really like constricted? Those are different kinds of critical symptoms. And then we think through, okay, now to handle this, do I have the knowledge I need, the skills I need, the tools I need to take care of this? So in a little while, I'm going to share some more information on critical symptoms because you might still be a little bit hazy on that. Like, well, I don't know exactly what would be critical. And truly, it does have to do with your capabilities to take care of it. But I do have a cheat sheet for you that I'll tell you about here in a little while to make sure you know, is this something that's really intense or can I take care of this at home? Okay, but those are your initial questions. So first thing, your child starts having symptoms, they get hurt, they're sick, and the only thing that you're going to do, rather than trying to be frantic and figure everything out, is just one thing. You're going to look at the situation and you're going to decide, is this critical or not? And I'd say, in my experience, 99% of the time, it is not critical. It's very, very rare, actually, that it's something that is like truly emergent. And when you build up the tools and the skills and the knowledge, like we're going to talk about going forward, those types of emergencies are going to get fewer and fewer. All right, so let's move into secret number two. You can be trusted with your child's symptoms. You do not need more credentials, so you do not need to go back to school. You can if you want. It's pretty fun. I think it's so fun to keep learning more like this. But to take care of your family, you do not need more credentials. You simply need a repeatable system that works. So the majority of symptoms, like I just said, that are treated in the ER can be managed just as well and often better by parents at home. I saw this time and time again when I was working in the ER. Even before I got into holistic health, I was like, why are they here? Like this is something that they did not need the ER for. And truly what the problem is that we are led nowadays to be very to not have any confidence in being healers as parents and being the hands and feet of healing for our children, right? We're led to believe, oh, something happens, you need to call your doctor. We're led to believe natural health does not work for big issues, right? That's a big myth that I've heard quite a bit. Oh, you can dabble in that. Okay, it's fine. You can do herbs for the sore throat. But if it's strep, no, you go get an antibiotic. If they have a little bit of a belly ache, okay, you can do the things, but they start throwing up. Oh, nope, you got to go get medication for that. We need to stop that, right? That's a really common myth. We're also told medication or like medicating for comfort is best care, right? So, oh, your child is hurt or they're uncomfortable or they have that fever that's so uncomfortable. Oh, just medicate them. We need to care for them. We need to give them comfort. That's a big one with partners who aren't quite on the same page. Like, okay, well, as long as their pain isn't too bad, we can, you can dabble in natural health. But as soon as they're really uncomfortable, we just have to suppress that, right? And that comes from a place of love. That comes from a place of care, of wanting your child to be comfortable, right? But it does come with an inaccurate view of how the body works. So, regarding you need to call your doctor, here's the deal. You know your child way better than any doctor. In an emergent situation, absolutely, but that's not a ring, ring, hey, doctor, can you help me? That's a hospital, go to the ER, right? Other than that, the vast majority of things, you will be able to take care of this on your own when you have the system. Natural health doesn't work for big issues. I'm going to tell you the truth. I have seen natural health work in countless infections that used antibiotics, and they were unable to resolve the situation with antibiotics over and over and over again. And then we used natural remedies, and it took care of it immediately. I've seen natural remedies stop heart attacks in their tracks. I've seen natural remedies stop strokes in their tracks. I've seen it even help for excessive bleeding and help for really intense migraines. Natural health is extremely effective for small things and for big things. And then finally, medicating for comfort is best care. I mean, kind of like I said before, that's coming from a place of love. I don't ever want my kids in pain. I don't want that. I don't want them to be uncomfortable. But at the same time, when we are uncomfortable, that's where growth happens, right? So that's where, whether it's physical health or whether it's emotional, whatever it is in life, when we have some discomfort, that's where we get more resilient. That's where we grow beyond. That's where we really learn and grow and understand. And it's the same with physical health. So with natural health, we can absolutely give our kids some remedies that will help them be less, to help with the pain, with helping them manage discomfort. But when we simply medicate and suppress those symptoms, it really distorts our ability to be able to help them heal, and it does not allow them to become stronger and more resilient. All right, so remember, the truth is you don't need more credentials. You need a method to get you out of the AIM spiral. The real reason holding you back from making natural remedies work in your home is an issue with your AIM. All right, you want me to tell you what AIM is? Okay. So AIM stands for anxiety, improvising, and minimizing. So here is the main hangup. If I ever talk with somebody who's like, I tried some natural remedies, they didn't work for me, and then we went to the hospital or we went to the doctor and got the antibiotics or whatever. It is every single time an issue with one of these things here. So A for anxiety. Anxiety is when you are stuck in that sympathetic nervous system. So when your child has a bellyache and they are just in so much pain and they're crying and they're tense, right? They are in the sympathetic nervous system place. So our nervous system has two main branches. There's sympathetic and there's parasympathetic. Sympathetic is when we are really tense and we're holding on. That's the classic bear is chasing you, right? And so you need to run from the bear. So everything heightens. Your heart goes faster so you can get more oxygen pumping and you can run better, right? Your eyes dilate. You're aware of everything. You're moving. You're fast. You're active. That's your sympathetic nervous system. Same thing happens even if you're not being chased by a bear. Same thing happens when you're in pain, when you get hurt, when you have an asthma attack and you're struggling to breathe. The sympathetic nervous system engages. This is a great thing the body does. It's so important for us to have that because, like I said, it makes more blood flow. It lets oxygen get to more places. It's very important for that to be the onset. But we do not heal in that place. Anytime we are in sympathetic, we don't heal. That's your kind of crisis intervention. But we only start to heal when we get parasympathetic, which is that rested state. So you're being chased by the bear. Finally, bear goes away. You're fine. You're like, oh, and you sit down. And you're like, okay, I can take a breath. And then you realize, oh, my toe hurts. Oh, I ripped off my toenail. How did that even happen? I didn't even realize when I was running, right? When you get into that parasympathetic phase, that's when you rest. You can be more aware. You can be more settled, and that's where you start to heal. As long as you're in the sympathetic nervous system, your body is mistrusting. So if your child's in pain and they're in that sympathetic, even though they trust you as a parent, they are mistrusting of you. Their body is mistrusting of anything coming to help. They say, nope, I'm not going to take it. They're unreceiving. And in that place, when they stay in sympathetic, symptoms escalate. That's when symptoms become emergencies. So if we can get from that sympathetic into that parasympathetic place, we help them get from that mistrusting and that unreceiving place to being able to receive help, and then symptoms start to come down. Okay, so that anxiety is the first place. Tell me in chat or on here live if that has been you, if you've noticed that. So if you've noticed that like being stuck in that sympathetic spot has gotten symptoms escalating. It's a very classic thing with asthma. I do a lot of work with kids with respiratory illness. It's a really big thing with asthma because you just get heightened more and more and more and more, right? And it's like more, everything is worse. And the way the moms potentiate this is by, oh no, what am I gonna do? I'm gonna run and grab the thing. Oh, I have a remedy. You sit right there. I'm gonna go grab it. And you make it more frantic, right? We do that. It's really easy to get more in that frantic mode ourselves, right? So being stuck in this anxiety space is absolutely one of the things that keeps us from being able to utilize natural remedies more or effectively. All right, number two is that improvising. So this is where that the social media thing comes into play. Like, okay, you hurt your head. Oh, I saw this thing and I think that thing worked. I'm going to try it out. And you're just kind of improvising, you're guessing. You don't have your system, right? You're not structured. You don't know exactly what you need to be doing. So you're doing generalized care for your child. When we do generalized care, we most of the time. Once in a while, you can kind of hit it. It's like luck of the draw. You're like, oh, that worked. But the vast majority of the time, you are going to get really discouraged because you're like, well, that worked for them. Why isn't it working for me? You're going to try to give a remedy. You're going to try to, use something that has worked for other people, but it's not specific to the situation. So when we improvise, we're not really coming from a place of understanding. We're kind of confused about how the body's working, and we're just trying different things. When we do that, we really don't see healing. Even if we see a little bit of relief, we're not going to have the long-term healing because we are not really getting focused in what their body is saying, what your kid's specific body is saying. And then the third is minimizing. This is when we do too little. So let's say we're using a remedy or, for example, a detox bath, which I really, really love, magnesium baths. And let's say you just do too little. So you fill a bath for your kid and then you put in like a little teaspoon of magnesium, right? You're like, well, it didn't work. Why didn't that? I did a detox bath. Why didn't that work? Because you did too little. What about too seldom? I talk to a lot of people who say like, yeah, my kid was sick. I know you talk about baths, so I did a bath. It didn't really do anything. Well, when we do that, we need to do it frequently. We need 2, 3, 4 throughout the day. We need to do it frequently to really support. And I'm using the bath as an example, but this is true of all different kinds of remedies. Foods are a huge one. I use food as medicine all the time. And so when we're using anything natural to heal, it's really important to make sure we're doing enough and then doing it frequently enough. And the last one is stopping too short. or yeah, not doing it for as many days as we need. You know, when you get an antibiotic, they say, all right, you're going to do this for 10 days, right? And you'll probably start seeing symptoms reduce and they'll feel better. Don't stop, keep on going, right? That's for some other reasons, but it's a similar principle when we're using natural health. We need to be continuing on. The body uses when we see symptoms, it's a sign that the body needs replenishing. And so we need to replenish with food and with with nutrition, with specific remedies, with detox support, with cleansing support. And we need to do it long enough because the body's going to take that, utilize it, start feeling really well. And if we stop too short, it's just going to come on back because the body is going to be like, oh, I was so close. Oh, never mind. Do it again. And we're going to see that spiral come up. Okay, so that's that AIM spiral, the anxiety, the improvising, the minimizing. If any of these resonate with you, put them in chat. Tell me what sounds like it's something that you have dealt with before that's led you to not see natural remedies really being effective. So here's a transition. So now, not the what nots to do, but how do we actually see our kids getting better, right? So this is the parent-led health method. This is what I was talking about in the beginning when I taught that patient of mine, Jesse, what to actually do to stop getting in that kind of frantic mode when her kid was getting sick. So the parent-led health method, instead of anxiety, this is where we bring peace. When we bring peace into the situation, this is when all other efforts can take effect. Okay. So remember, I was saying when we're stuck in that anxiety spiral, when we're in the sympathetic nervous system versus the parasympathetic, we cannot receive, the body will not receive help. It will not be open to taking help. It'll be on guard, right? And kind of thrust everything away. Even if your child is physically taking the things, the body itself will not be receiving. When we are in peace, that's when all these other efforts can take effect. So that's where we start with bringing in the peace. Insight is next. So instead of improvising, we're going to start doing having insight, right? So when we come from a place of understanding, instead of guessing, we provide appropriate, logical, and effective care. But we have to come from this place of understanding specifically our kids. And that's why we as parents are so well set up for this because we know our kids so much better, right? I know when I know when my kids are going to start showing symptoms, or I know when my daughter becomes more like clingy with me and wants to be more on me. I know she's going to start having respiratory symptoms because I've seen her and I know that with her, right? So when we are coming from this place of really knowing our kids and understanding their trends and what's typical with them, we can provide really good, appropriate care rather than guessing and rather than basing care on things that we've seen other people trying. And then finally, rhythm. So our bodies crave replenishing, like I said before, right? Anytime we're sick, our bodies need replenishing. They need nutrients. Anytime our bodies are working on detoxing, which is every time we're sick, we get depleted in minerals and we get depleted in fats. Our fats get used up really fast. So our fatty acids, we need to replenish with those things. We need more magnesium and calcium. Typically, we need the vitamin F. We need these different things. And when we replenish and consistently and frequently, our bodies are able to really take those, use them to refill what they needed, and have sufficient amounts to get stronger and more resilient after that. So when we have that rhythm and we're using that appropriately, we see that resiliency come. So let's just break this down a little bit. I like systems like this. So when we have peace and insight, so you're like, okay, I got my child calm and I understand exactly what to do, but we don't have a rhythm. We see that failure, that broken loop, right? So you're like, they are nice and calm. They're ready to receive. I've given them the right remedies, but you only did it like twice. Their bodies get excited first and just fail because we didn't really follow through on that, right? When you have peace, you bring peace into the situation, your child's ready to receive, and you're like, I'm going to do this constantly every day, as many times as it need, but you don't know exactly what they need. That's where that frustration comes in. You're using the wrong tool, even though you have the other things right in place, but that's where you're not seeing any improvement, and that's where frustration comes. And then if you have insight, you understand what's going on with their body, and you're ready to do it as frequently, support them as much as they need, but they're still stuck in that anxiety place and they're not coming from a place of peace, they're gonna have that fear and they're gonna just be in that panic loop. All right. So how do we really implement these, right? Because this is the main symptom, or I keep saying symptom, system that we need to use here. So peace, how do we bring this? This starts with mom's breath. So remember I said before, imagine your kid is, having a respiratory attack and they're struggling to breathe, and you're like, okay, I'm gonna get the thing, and you go get that, and you go find me the inhaler, and you do this. We're just bringing more anxiety to the situation. But when we stop and pause and we take a breath, we get ourselves from the anxiety space to that parasympathetic, from the sympathetic to the para, that rested place. Okay. I'm always in sympathetic when I'm speaking in a good way. I get excited and I talk fast and I'm excited about what I'm talking about, right? So I'm really like heightened with this. When I take a breath, it totally changes my body. Like everything changes in my mind, in my body. And that's what we need when your child is sick, for you to say, hold on, I'm going to start with myself. Okay. There is a trick when you do that 3 times, in your nose and out your nose 3 times, that does get your body from being in that acute, like sudden sympathetic into that rested place, or at least getting you started into that. So 3 breaths. This does not have to take a long time, right? We're not like standing there, pausing, not moving while your child is hurt. You are going to them and in just a couple breaths, getting yourself to calm. Then you're going to provide reassurance. So you're going to go to your child and you're going to say, I see that you're hurt, or I see you're struggling to breathe. I see you. I'm going to take care of you. I know exactly what to do. I am going to help you. You are going to get better. And you're going to encourage them. And you're going to say, you are such a strong child. I know that all the things that we've done, whatever it is, the burger you ate last night made you even stronger so that you can be able to get through this, right? I know you're so strong. I know that your body is working hard to get you through this, and you're totally going to do it. And I'm going to be right here with you the whole time. And then we provide physical comfort. And that does not necessarily mean that you have to like hold them to yourself, especially if they're struggling to breathe. But one thing I really like doing with my kids is I like for them to hear my heart. When their ear is on my heart, they start to match that. Their heart rate comes down and calms. Their respiratory rate comes down and calms. And they start more to match me. And you can visibly see them starting to calm. So again, whether this is an injury, a sickness, a fever, a bellyache, whatever it is, we can, through this, start getting those symptoms to resolve or to de-escalate rather than escalating into an emergency. And this is always where we start. Now, for some people who have chronic illness, again, with asthma, it's a good example. If there's a situation where you're like, but they always have to have their medication. Every time they have to go to the hospital, or this has landed us, they have croup, this has landed us in the hospital many times. Sometimes your goal in the very beginning is just delay that. What if you can delay the medication by 5 minutes or 2 minutes or 10 seconds rather than giving it immediately? Because the medication does provide immediate relief, or, it often provides emergent relief if that's needed. And if this is an emergency situation, hear me out, like use emergency measures if you need to, right? But very often, even if you just delay that by 10 seconds more than you normally would, that gives the body 10 more seconds of being able to adjust and start working to repair itself. So even if you wind up giving the med, or you wind up going to the hospital, using this method is going to get their body set up to start healing more than it would if they were in that anxious, frantic place. Okay. Insight is next. So this is where we go from being that, like doing the guesswork for what they need, and really understanding. So once you've provided that piece for them, and again, that can take less than a minute, right? You're taking 3 breaths yourself, you're going to them, you're reassuring them, encouraging, letting them know they're going to be all right. And then you start really observing them closely to see what we need to do. You're going to make that determination. Do we need to go to the hospital? Do I need to am I able to care for them here at home? Determine, if we're out of the house, do we need to go home? If we're bike riding, do I get them off? Like determine like your initial course of action and then start understanding what they need at this time. Okay. That understanding piece is a growth piece. I do have a resource for you. I'm going to show you at the end to really help you understand every single one. So if what's happening, if they have a fever, if they have a bite, if they have a rash, if they have food poisoning or constipation or diarrhea or whatever it is, right? Whatever happens, how do you really understand what the body is doing there? And then you select your remedy. So that's the insight. Okay, we're going to go through this process, not just hey, pull up that Instagram reel so I can see what that thing was. I'm picking on Instagram a lot right now. But not just kind of grasping at straws or even grabbing your book and trying to flip through and see what to do, but really settle into observing your child, understanding what's going on specifically for them, and then selecting your remedy. Whether that's food, a detox support, a homeopathic remedy, an herb, whatever that might be. And then we're going to work on our rhythm. So we're going to do specific doses, we're going to do frequency, and we're going to do long enough duration, right, of whatever we chose. So here's that sequence, right? We're going to assess the situation. We're going to do that first initial. Is this obviously an emergency? If so, we call an ambulance, we take them to the hospital. All during that time, though, whether it's an emergency or not, we're going to be bringing the calm. Okay. We're going to determine our next steps. We're going to understand the root cause of what's going on. We're going to select our remedy, and then we're going to administer aggressively. I like to say aggressively because my husband and I grew up in very different places. My husband's from Kansas, and I'm from New Jersey. And he was taught to drive carefully and cautiously. Those are the words that were used when he was learning to drive. I was taught to drive aggressively, and they are very different. I would say we're both good drivers. I really like when my husband drives, but he's definitely more of a careful, cautious driver. He's making sure everyone around is okay. Everybody good? You good? You going first? Am I going first? Right? Like just kind of taking a survey of the whole scene. With me learning to drive aggressively, that meant, in New Jersey, we're like on the highway, very busy, lots of people, and you had to know what to do and do it and not be constantly distracted by the things around you. And that's what I like with giving remedies. Don't be distracted by the little things that pop up where everybody giving you input. Have a plan, administer aggressively, right? That's when we see effectiveness. Okay, secret number 3, how to start healing naturally, even if your spouse is not on board or if you don't have a full kit of remedies. This is going to sound really simple, and it is, but this is the truth. You just start. You're going to bring the calm. Everything I just said is appropriate, even if your spouse is not on board with this, right? There is nothing wrong. There's nothing going against them if you simply start bringing the calm, bringing that pause, taking the breath, understanding what's going on, and trying something, whether that's I'm gonna try this, this one food, or put them in a detox bath, or that one thing, okay? Because healing really starts to happen with calm and pause. And even if you wind up giving medicines, or even if you wind up going to the hospital, you are starting your child's healing by bringing that calm to them. So you're gonna start with that peace and with that insight, and then you're just gonna go very simple, slow, and steady with remedies. Now, I'm going to show you a resource that I have that really breaks down remedies and how to know what to use and everything. But truthfully, the body, when you look at it holistically, we're not looking at the brain as a separate entity, the heart as a separate entity, the liver as different, the belly as different. Everything works together, so that even if you only have 2 or 3 little remedies that you can try, those will generally help. If you have one thing that helps build the body's strength and one thing that helps to cleanse, you're going to start to see some improvement. Usually, when I can only choose one of two things, I'm going to choose salt, a good quality salt for those minerals that help to provide the body with strength, and a magnesium bath to help the body cleanse. Even if that's all you have. So Epsom salt is magnesium or magnesium flakes or something like that. Even if you just have a quality salt, so an unrefined salt and magnesium to put in the bath, you can do so much with both of those when you bring in the peace and then use those two things to help the body. All right. So far, we went through getting away from that initial response of panicking, Googling, defaulting to medications. We talked about you can be trusted with your child's symptoms. You don't need more credentials. You just need this repeatable system. And then how to start healing your child naturally, even if your spouse is not on board or if you don't have a full kit of remedies. If you have any questions or thoughts at this point, go ahead and stick them in chat if you're here live. We're going to get to some questions at the end, but you are welcome to put them in there. Okay, so I am curious if anybody's feeling a little bit like this, because I know it's easy to see a system, but then be like, yeah, but what things are critical? And like, how do I know what this means, right? Like, how do I know what that fever is telling me, right? So sometimes it's easy to feel a little bit like this. um, Here's what I want you to imagine. Imagine your child has a respiratory infection and you know exactly what to do. Imagine your son gets an injury and you are able to help him from a place of peace and insight. Imagine you and your husband are unified when your kids become sick because you have both seen natural health work. Imagine when your child has a fever, you know what to look for to know if you need help. Imagine when your kid has a bellyache, you calmly assess it and treat it without panicking. And imagine you are confident, you are prepared for the next sickness, you are at peace with your family's health. All right, so how do we actually do this? We have two options. So doing it alone is one. That's how I did it. And it took a long time and it took a lot of trial and error and experimentation. But like pouring through books and listening to podcasts and doing all the research is one option. I do want to provide you with another option though. So doing it with direct guidance and a treasure trove of resources is the other option. So I would like to tell you about this treasure trove of resources that I have for you. If that's okay with you, give me a yes. Yes, perfect. Can I talk about it here? All right. So before I get into the main thing that I want to show you guys that provides a lot of support for you, I have a couple different bonuses that are going along with it right now. So bonus number one is the home versus hospital flowchart. So this is a list that you can go to when your child is sick, when your child is hurt. It helps you recognize what signs you're looking for. So you start up at the top and it says, is my child this? Yes or no? And then you're gonna, if this is the case, tells you what to do. If this is the case, tells you what to do, and you keep on working down that. This is a really nice flowchart to just simplify, is this a hospital situation or is this a home situation? So that you can make wise decisions, so you can stop spiraling when it comes to that question of, I don't know, this is kind of borderline. I don't know. Is this safe? Am I being unwise? Am I being too obstinate? I will not go to the hospital. Or am I going to the hospital when I really could have taken care of this at home, right? So this is going to help just sort that out for you. The next bonus is the Remedy and Supply Savings Vault. So if you're like me and you're like, oh, it sounds really, really awesome to have all these different remedies, you can easily spend thousands of dollars on getting all different kinds of remedies. So this Savings Vault helps you be prepared for your child's next sickness or injury by helping you know exactly where to get your tools, making it really simple and doable to get the things that are just needed, not necessarily looking at all of the different places to get things. This is where I have it listed of each of the things that I really like. So the products, the supplements, the herbs, the remedies that I have used and have really liked, and also some different products here as well. But things that I've used, I have seen that it's been very beneficial. I always write to companies and say, hey, can I have a discount for the people in my community? And most of the time they provide that. And then that's what I have provided here for you. So you can save a lot of money and really narrow down what you're getting rather than just kind of looking at tons of different things. Okay, so I want to introduce the Parent-Led Health Toolkit. Um, and I know that some of you on here right now are part of the toolkit, which is awesome. Some of you are not. And for those of you watching later, maybe you are part of the toolkit. If so, I am so glad. And if not, I'm inviting you to join. So what is the toolkit? This is your plan to turn to as soon as your child has a bellyache and you're not sure what to do, when they wake up with a fever, when they're coughing in the middle of the night. It is right there, ready to go on demand. It's very simple to use. So in the toolkit, it gives you a variety of symptoms. Okay. So you log in, you can have it right there, ready to go with your login all set. And then you just click on the symptom. So whatever it is, you click on the thing that it is, the extremity injury, right? Or the rash. And so you click on rash and it's going to show you exactly what to do. So what do I do when, what am I looking for? What's going to show me that I need to go to the hospital? What's going to show me that I can stay at home? It's going to show you all of the things like written right there for you to go through to be able to manage that rash yourself. The other part of what you're going to be getting is Holly in your ear. So you're going to have me with each of the full protocols. You have me saying, all right, so you click on the abdominal pain and you press play and you have me saying, all right, this is what's going on. This is what abdominal pain means. It means that the body is working to detox, and it means that the body needs to have some microbial support. We want to bring in this and this. This is what to look out for. This is how to tell if it's a likely appendicitis. This is what you need to do, if it's getting worse. This is exactly what you need to be looking at, and this is what you should do at home. So just a nice guide for those of you who are like, I just want someone to talk to me. You press play right there in the moment. It's going to walk you through what to do. I really made these honestly because I have lots of friends and family calling me and they're like, I know that you have things written out, but I just kind of want to hear you talk me through it. I'm like, oh, well, I can just do that. Let's just do that with all of them, right? And so you have those audio guides there for you. Next things in the toolkit, you have step-by-step instructions on what to monitor, what to look for, and when you should get help. So this is going to be those written components. So if you're like, I don't have time to listen to it, or I just want to get a visual, this is going to walk you through exactly what you're going to be doing. So you're not wondering if you're doing the right thing. You're very confident in that care that you're providing. Hannah, I see you. I have the toolkit. It's excellent. Thank you so much. That's awesome. Nutrition guidance is going to show you which foods will help your child heal from their injury or their illness quicker, and which foods are going to delay healing and make their symptoms worse. Okay. So it is actually really important. Food is so powerful. It can help you. It can make it, it can create healing, or it can create delay of healing and even make things worse. It's important to know what to do. You're also going to get a proactive guide for helping you get ready for whatever's next. So just so that you have all your things, you're going to have a guide of this is what I recommend in this situation. So if your child is prone to respiratory illness or rashes or belly aches or nausea or constipation or whatever it is, you can go and see what your child is prone to and just get all of the things ready, have your toolkit, right? Your physical toolkit ready there for the next time some symptoms arise. You're going to have supplement guides. It takes you through knowing which remedies are appropriate in different situations. You're going to get video tutorials so that you know how to do the assessment like an ER nurse, right? So I do definitely bring in my ER nursing background into this as well, because there's a lot of good that we can see that we can have from that. And so how to assess like an ER nurse, how to do different remedies, how to apply different things. So you'll have those videos in there. Now, it sounds like a lot, but I do. My goal is to make this so easy. I have so many reference books. And when I was first starting, my kids would be, they would be sick and I would be like rustling through these different books, like, oh, is it that one? And trying to find the exact page. Is it that one? Trying to find the exact page. My plan here with the toolkit is to make it so simple. You go in, you choose your symptom, and you follow, right? And you just work through it in accordance with what your child needs. There's 3 parts in it. You have your holistic jumpstart as your part 1, where it takes you through some really important videos and mindsets that you need to have as you go this route. So if your child is not in a situation right now and you have just a few minutes to go through some of these videos, it's a great place to start. Then you have your symptom management, which gives you all of the items throughout the tool or all of the symptoms that you can select and give you all the protocols there. And then the third is the extra things that just really enhance your ability to grow in your confidence in handling your child's symptoms. That's where your video trainings, your supplements, your therapies, your homeopathy information, different bonuses, things like that are in there. Miriam is one of the moms in there. She said, I did exactly what you said in the urinary protocol, and her UTI went away. I didn't need to use the antibiotics, so now we don't have to start from square one again with her gut. Miriam did a lot of work for her daughter after she was having some gut issues, did a lot of work to build that up, and she was really not wanting to use the antibiotic. And so when she was able to do this without going that route, it was just a game changer for her, really helping to continue that long-term healing for her daughter. I was so happy to see that one. Brianna's another mom in the toolkit. She said, I followed your steps in the symptom toolkit, and it was almost unbelievable how quickly and effectively it worked. I kept waiting to see if the infection would get worse, but it completely went away, and he's totally normal. Thank you. Now, this kind of thing, looking from the ER setting, if this has come into the ER, this kind of infection, immediately antibiotics. A lot of times it would be IV antibiotics, and often steroids and some other things depending on how he's doing. 8 hours later, look at that. It's amazing what natural health can do. I'm not like, oh, look at my remedies, right? No, it's just there's this list of just do these things. And when you use these steps, it works so well. It's awesome. This is unlike other programs for a variety of ways. First of all, I've never seen another program like this. I don't know. I think it's because usually it's either allopathic, meaning Western medicine, or natural, right? But my goal is we do not need to live in one or the other, right? In the majority of the time, it is best to live naturally. I fully believe that. But there are certain times when the medical system is really helpful, and we need to know when to use both of those. The other thing is my goal is to provide real uncensored info for you. There is a lot of fear of practitioners when you go against or not even against, but you give another option to what the medical system says, right? And there's a lot of liability. There's a lot of, you get a target on your back when you do that. And to be honest, that's why there's not more programs like this. But that's what I'm providing. So uncensored info, you take it and you get to make the decision as a parent, right, of what to do. It's updated in real time. For example, the measles protocol, I put that in when I was getting lots of calls about measles, when that was big in the news. And so every time there's something else like that, when I'm getting a lot of calls or when there's something big in the news or going on, you're going to get those kinds of protocols for that. So I update it regularly like that. And this is coming from the expectation that the body was created to heal. So I fully believe our bodies were created to heal, to be able to heal when we provide them with what they need. And that's what we're going based on. So other kinds of methods of healing kids or working through symptoms really don't go based on that. They base on what has man designed that we can use to try to make the body stop going crazy. That's a funny way to say it, but it's working against how the body was normally or created to be able to heal, right? And so when we support the body versus suppressing, we do see the body healing, and that's the way that we're going about this in the Parent-Led Health Toolkit. This also addresses root cause versus symptoms. Symptoms are amazing. I think symptoms are one of God's greatest gifts to us because we can actually use symptoms to see what the body is asking for. We don't have to live in this weird unknown mystery. When we have symptoms, it's simply showing us what the body's doing. So when we see that, it's like, oh, fantastic. My kids actually know I love when like a rash pops up or if they have loose stools. They're like, guess what, mom? And they tell me and they know I'm going to get excited because I'm like, oh, fantastic. Now I know what your body needs. This is wonderful, you know? So when we address root cause, now this says root cause versus symptoms. Symptoms are fantastic, but when we just come in with the mindset of suppress symptoms, that's like chopping off our leg. We don't know what to do in that situation. So when we medicate to get rid of symptoms, we don't know what to do. But when we are addressing root cause through symptoms, that's when we see our kids healing. This is another one of the moms who, this one touched me because she said, thanks so much for helping me out. You have such incredible information on here. I've been looking for something like this for a long time. And this is what I was looking for a long time too. And I really wanted something and had to create it. So that's why this is here. All right. So you guys are invited to join the Parent-Led Health Toolkit. I'm going to go through pricing because everyone wants to see that, right? So the bonuses, the symptom protocols at $540, the audio guides at $270, going through all of these, the critical symptom guides, $27, the nutrition protocols at $50, the resource PDFs at $50, supplement therapy guides at $27. Takes it to $1,240. That the toolkit value. But your price here is $297. So $297 is what is offered at right now. For all of this, just $297. And then this is a new thing. For lifetime access. So it has always been a membership in the past. It's always been either a monthly or an annual price. But I changed that. I don't know how long I'm going to change this. Maybe this will be forever. I don't know. I might change it. I'm totally experimenting here, but this is going to be lifetime access. So anyone signing up right now, this is for life and you will get all the updates. You'll get everything that's in there for as long as the toolkit exists. Okay, but one more bonus. This is my family health cards. So if anyone has seen these are normally $47. These are quick printable reference cards that you can have on hand. They're like this. I created these because I didn't want to have a babysitter over or grandparents come over. And then something happened and they're like, oh, here's the medicine. I had this in my purse, And I was like, no, don't do that. So I actually created these originally for this to be a really good reference or resource to have for people who are watching your kids. Throw it in your diaper bag, take it with you. But it's a little shadow of the whole toolkit. But these are really nice to have just to have on hand. I have mine on a little spiral. It's on my fridge. And actually my kids really like going to it and they're like, oh, now that they all basically read now. And so they're like, work through it. I think it's fun. So if you enroll in the toolkit in the next 48 hours from watching this, for those of you watching later, take a look at what's below the video because you're going to see what's still available there. But if you enroll within 48 hours, you will get my family health cards included. And that'll be a PDF that'll be sent to you. And then you can choose if you want to print it and laminate those like I have. All right. All right, so here we are, $1,240 in value for only $297 for lifetime access right now. I'm going to put a link in chat. For those of you watching later, you will have a link there available for you to go ahead and grab that. And then we're going to go into a Q&A. So I'm going to go through some questions that came in from people who were not able to attend live today. And if you do have any questions, please put them in chat if you're here live. I'm just going to pull up. Oops, sorry, guys. I'm going to pull up my link to add in there. And then we'll get started. Actually, I'm going to stop the share.